What is the process for ADHD testing? Hi, my name is Catherine, and I'm a therapist with Mindful Healing. When it comes to ADHD, a lot of times it's underdiagnosed, which is surprising for a lot of people. There's a big reputation of ADHD being overdiagnosed, especially in young children. And while this is true, it's also true it's underdiagnosed. These things may seem like they can't agree or can't coexist, but thanks to the foundations of DBT, we know two things that sound opposite can be true. So, in this instance, we're talking a lot about older children or girls or kids who present with combined type ADHD or inattentive type ADHD, which are underdiagnosed due to the lack of hyperactivity presentation that is typically associated with ADHD. So, what does the process entail? How do we test our children if we suspect or if our therapist suspects that there is ADHD here? The first part involves observation. This takes time and sessions. Over the weeks, a therapist can observe specific patterns that are associated with ADHD in your child's behavior. This could be things like not being able to sit still during session, having a hard time following conversation, or it could be patterns within their stories. Maybe the way they tell stories, or maybe specific themes that come up often could indicate to the therapist that there could be ADHD at play here. If this happens and there's enough observation to encourage the therapist to seek a screener, there are then screener tests that are given to children who may have ADHD. These screeners vary but are essentially based on the DSM diagnostic criteria. Using these screeners, we can then ask a series of questions to determine if the child has ADHD, and if so, what type. This particular part of the process is much quicker and takes less than a session. Then, looking over the actual screener and combining that with looking over previous notes, your therapist can determine, usually by the next session, if your child would qualify for an ADHD diagnosis. The other process that is available is to pay to send a child for a full psychoanalysis. This process is more expensive and takes longer, but is extremely thorough and can provide a number of different perspectives in potential diagnoses, which can be extremely helpful since ADHD is often comorbid with something else, such as anxiety or depression. If you have any further interest or questions, please feel free to reach out to Mindful Healing. Thanks.